The broadcast is now starting. All attendees are in listen-only mode.
Yes. Hello, this is Bill Stalecki. Thank you for joining us in our webinar today, planning for extreme heat events in the context of in the context of the COVID-19 pandemic. The objective of today is to sort of bring forward what we're understanding as sort of a compounding risks and hazards. We certainly recognize the current pandemic crisis and the implications that has for the public health community and the resilience community more broadly defined. What we're trying to look at as well is how some of these issues connect with the emerging question of extreme heat, and particularly some of the planning efforts that have been in place and prepared in communities throughout the Northeast of the United States, and what are some of the cross connections. So I'll speak a little bit more about the introduction of the event and sort of lay out a little bit of the framework. But I want to turn it over to Ellen McCrae from the Regional Climate Services Office as Director for the Eastern Region of NOAA. Ellen.
Well, thank you, Bill. And I just wanted to welcome everybody and thank you so much for registering to attend today. This is an important issue and one that we wanted to pull together in advance of the heat season for the Northeast. And so are pushing to get this out to you in time for the Memorial Day holiday weekend and the opening of many of our summer assets, including beaches. So, but we also want to welcome very much Oliver be coming to us from the Somerville area too, and I just want to thank him very much for joining. So as Bill said, I'm the Regional Climate Services Director for the Eastern Region. There's Oliver, good. And I am seeing people live on the screen here now. Greg, I'm hoping to see you as well. And I've got Perry who's paused, so just double checking here. But just wanted to say a quick thank you again to everybody for putting this together, and thank you to all of you for registering. And I am teaching third grade, so you can see. Oh. So thank you guys so much for joining, and I will turn it back over so we can get started here.
Thank you, Ellen. And really, as I've sort of started the conversation, this really is designed to be a conversation. We're going to hear from a series of experts, people who have been looking at the question of climate and also extreme heat and potentially connection to COVID-19. So we'll have a series of short presentations and then open it up for questions and comments from you all. So it's really, in some ways, we're providing information and then also creating a dialogue. This effort is part of a NOAA-funded initiative called the Consortium for Climate Risk in the Urban Northeast. It's one of the NOAA RISA programs, which are regional entities that provide new and emergent climate information to pressing public policy questions. And certainly this sort of fits into that category. So we'll have a series of folks presenting on this. You can see the agenda below. Radley Horton is a Lamont Associate Research Professor and a climate scientist, has done extensive work on climate modeling. He'll speak a little bit about some of the expectations for the summer and the questions of potential extreme heat. We'll sort of shift more directly to this question of the connection between heat impacts and the context of the COVID-19. Greg Wellnius, the professor at the Boston University, who looks at that cross connection between epidemiology, environmental health, and human physiology in the context of climate, will speak for a few minutes. We'll move there directly, sort of looking at questions of vulnerability and different sort of populations exposed to these kinds of risks. We'll hear from Perry Sheffield, who is the co-director of the New York State Children's Environmental Health Center and the deputy director of Federal Region 2 Pediatric Environmental Health Specialty Unit at Mount Sinai, the Icahn School of Medicine at Mount Sinai. We'll then sort of move from this sort of presentation of risk and hazard into some opportunities of resilience, and to sort of begin that dialogue of what to do, how to sort of move forward from this current question. Franco Montalto, who's a professor of environmental engineering at Drexel University, will specifically focus on some of these sort of initiatives that are being developed to sort of mitigate extreme heat, in a more rapid fashion as we sort of move into the summer. And then we sort of move out into the field to begin our dialogue with you all. We're very fortunate to have Oliver Sellers Garcia, who is the Director of Sustainability and Environment at the City of Somerville, Massachusetts, to sort of start off that discussion with us today. And then sort of following all that, we'll also have some words from Julie Turjan, who is also with NOAA from the NOAA Climate Program Office, to sort of bring some of these threads together. So we recognize, just as an outset, that the COVID-19 has changed everything about our everyday, and has certainly created questions about risk and hazard management. I think we're already starting to see the profound implication that this challenge has, not just in our everyday life, but also how it interconnects with our hazards and risks that are around us every day. We see that playing out literally today in the state of Michigan with a dam failure and evacuations that have to take place under the context of COVID. We're seeing that globally, literally today, with the evacuations, preparedness for typhoon, Category 5 typhoon moving in toward the Bay of Bengal. So these are graphic illustrations of this intersection between hazard and COVID-19. And that's really, in some ways, what really motivated us to sort of accelerate the planning process to look into these questions and dive in as quickly as possible what this might mean for heat, extreme heat in the Northeast. So with that, I want to sort of shift. We do have some moderated Q&A questions which will follow this discussion. But with that, I'd like to sort of move to our first presenter. I'll give the floor to Radley Horton. Again, around 5 minutes, and then the other speakers will speak a little bit longer, and then wrap up quickly to promote as much Q&A and discussion, both amongst the panelists and between the panelists and the audience, in some cases among the audience as possible. So I'll shift it over to Radley.
Thank you, Bill. Can everybody hear me okay? Good. Okay. So yeah, I just want to second Bill's thanks to all of our speakers today, to our NOAA partners for making this possible. And we're really excited to hear from all our presenters, and then to have time for a rich dialogue thereafter. So I am going to limit my remarks to talking about really the sort of climate dimension. What are we expecting this summer in terms of temperatures in the Northeast? How have the gradual shifts in temperature as greenhouse gas concentrations have grown in the atmosphere already shifted the statistics of how often we're experiencing extreme heat events? And as we look to the future, just how quickly are we going to see major changes in the frequency of extreme events? So there's a lot of associated related questions we can get into later. I think it's going to be so exciting to talk about things like, how is the COVID-19 crisis impacting emissions of greenhouse gases, concentrations of other critical pollutants? What's it doing to vulnerability in our region? This efficacy of different resilience strategies. Are we learning more about cascading impacts through COVID-19 and the vulnerabilities, the indirect ways that, say, a heat wave or COVID-19 can have cascading and systemic risks across society? What's it teaching us about shifting behaviors and norms? And then longer term, what are the policy, macroeconomic, and sort of social psychology dimensions? Are some of the shifts that we're seeing towards less greenhouse gas emissions potentially going to become long term? But those are all things we'd love to hear your thoughts on throughout this webinar and in the Q&A thereafter. But as I said, I'll just in a couple minutes now take us through the heat dimension. So this first slide you're seeing here is NOAA's forecast issued almost exactly 1 month ago for the 3-month summer, June, July, and August. This will in fact be updated tomorrow, but expect the overall contours to be similar tomorrow. Basically what you're seeing here is anywhere you see that very red color, that suggests that the average temperatures over this summer, there's a 60% chance that those temperatures are going to be higher than they would be in the typical 30-year period. say, a typical summer from 1980 to 2010. So the odds are we are going to have a warmer than normal summer. Now, does that necessarily mean we'll have more individual days that are really hot? Not necessarily, but the balance of evidence suggests an above normal temperature summer, especially in the Northeast, as you can see right there. So if we unpack this a little further, these are forecasts, that are made a couple months in advance. A lot of the information that's going into this forecast isn't reflecting the latest water temperatures or the latest atmospheric patterns. Really, a lot of the forecast is getting its information from essentially the impact that we have already had on the planet through increasing greenhouse gas concentrations. We have shifted the statistics so that it is now much easier to get a hot summer than it was, say, 30 years ago. And here's a graphic that really captures that. I should say this is not Northeast specific. This is across 1,800 weather stations all around the United States. What you're seeing here by year, going back to about 1930, is across all those weather stations in a given year, how many record-breaking high temperatures were experienced versus how many record-breaking lows. The blue columns are cases where there were more record-breaking low temperatures in that year than there were record-breaking high. And I just wanted to quickly put this up to demonstrate with real data that the statistics really have already shifted. It's now far more likely that we get more record-breaking high temperatures than low in a given year, and we can find individual years that have had 7 times as many record-breaking high temperatures as record-breaking low. So this is how that small shift in average temperatures, we've only had about 2 degrees Fahrenheit of global warming, but it's already been enough to shift these statistics. So that's the shifting baseline that plays out as greater risk for our communities in summers today than we had in the past. And then finally, to go to the next slide, we can look to the future and say, as we get to the middle of the 21st century, just how much warmer might our hottest days of the summer be. And the top panel is depicting that sort of worst day per year. How much hotter might it be 30 years or so from now, essentially just a generation from now, on a trajectory where we don't, as a society, reduce our greenhouse gas emissions a lot. And that top panel is showing you that our best estimate is that that hottest day per year could be 6 degrees Fahrenheit or so warmer than it is today. So to the extent that a place like New York City might have its typical hottest day of the year be, let's say, 97 Fahrenheit, that suggests that day might be 103 degrees Fahrenheit, ballpark, just a generation from now. So think about our human vulnerability, think about our vulnerable populations, think about our critical infrastructure, our electric grids, our roads. Are they able to manage not just those higher extreme temperatures, but far more frequent occurrence of temperatures of, say, 95 degrees, 100 degrees. So this is that context that we should all be thinking about the long-term shifts that are changing risks, even as we now delve much more deeply into the COVID-19 crisis and what that is meaning for our health and associated resilience types of questions that we're going to hear so much about. So with that, I'll turn it over to my colleague, Perry Sheffield, to begin to unpack some of those health dimensions for us.
Actually, I think we wanted to go to Greg first. Is that correct?
I apologize. Yes.
Okay. All good. You're eager, which is good. So we'll go to Greg first. Greg Wellnius, talking about health. So translating this into the health domain.
All right, great. Thank you, Bill. Thanks for the introduction and thanks for the invitation to be here. I don't see my slides on the screen though. Hey, Bill, we see a white slide. Okay, thanks.
Yeah, I think Dan is going to set them up. I just saw them for a moment. There.
Oh, there we go. Okay, great. There we go. All right, thanks. You can go ahead to the next slide. Great, so I'll be relatively brief. There's a huge literature on the impacts of, in particular, extreme heat, and what we think we know from, a large number of studies across the world, certainly across high-income countries as well, and specifically within the U.S., all the way down to individual communities. So a very large body of evidence showing that extreme heat is associated with higher rates of death and hospitalization. There's a variety of studies that then try to quantify how many deaths, how many hospitalizations. So we're starting to get into being able to put actual numbers on this. We also know that it's not just on those very, very hot days, sort of the days that typically trigger heat warnings that are dangerous to our health. It's even days of moderate heat are associated with measurably higher rates of death, and probably also with hospitalization, although there's fewer studies on that. There's a large body of evidence again showing that there's these effects are not evenly distributed across the population. There are differences in vulnerability according to personal characteristics, types of housing characteristics, and neighborhood or community characteristics. I think Perry will talk in more detail about that. And as Bradley already pointed out, the US has already warmed a substantial amount and is projected to warm further through the end of the century. Next slide. Great. So one of the projects that Kate Weinberger, who is a former postdoctoral fellow that worked in my group and is now faculty at the University of British Columbia in Canada. So one of the projects she led was, we didn't actually have, it's often said that heat kills more people than any other weather-related disaster. And, those numbers are based on death certificates that actually count on how many death certificates was heat mentioned as a contributing cause. And in fact, we thought that the sort of statistically derived excess number of deaths was probably much higher than that. And so Kate Weinberger looked across the country using mortality data through 2006 and found that in fact we're probably underestimating the number of people that die from heat by about an order of magnitude versus the death certificate based studies. So we think that there's somewhere in the order of 6,000 deaths attributable to heat, and that's just in these 297 counties that where we had data that represents about 60% of the US population. So the true burden of disease of heat is probably much higher than we've anticipated. Next slide. And of course, this risk is not evenly distributed across the US. This shows the excess number of deaths per year associated with extreme heat, defined as the days above the 97.5th percentile of the county-specific temperature distribution. And this is a scale to million, excess deaths per year per million people, so that, we're not just counting bodies, but dividing by the denominator of how many people live in that area. And you can see that the largest impact in terms of excess heat-related mortality appears to be in the Northeast, where we have about 46 deaths per million people per year. Next slide. So, of course, the context really matters. This is a well-known figure from the IPCC, and you see that risk of an adverse health outcome in this case is at the intersection of hazards such as heat, exposure, which is just because it's hot outside doesn't mean that we're all equally exposed to that heat. Some people have air conditioning and the finances to run it. Other people might have to work outdoors and not have access to, have the choice to be in an air conditioned space. So exposure varies dramatically across the population, and then vulnerability to these individual effects varies at the individual level and at the community level. So it's the intersection of the hazards, the vulnerability, and the exposure that determines our level of risk. Next slide. And so, given that context, you see that that heat exposure and vulnerability are not equitably distributed. This is a graphic I just saw today for the first time, actually, and it just shows in the red to yellow scale there is the afternoon temperature based on satellite surface temperature, and then this is, sorry, for the city of Boston. And you know, those neighborhoods that are hottest are also the ones that have the highest concentration of lower income residents, as shown by the circles of various sizes. These are also the neighborhoods that have the lowest amount of tree cover. So there's always, we have to think of the contextual factors of the social determinants of health that then, you know, may make people both more vulnerable to heat and more exposed to heat. Next slide. And it's even, you know, some of the work we've been doing in our group suggests that we have to even be careful that heat is not the only hazard that we might expect in the summer. So you can see there in the small panels, sort of the spatial distribution of the probability of having one or more day in the summer with a heat index greater than 95 degrees, or more than 1 inch of precipitation, or more than 70 parts per billion of ozone, or higher PM 2.5 levels, ambient particulate matter. And you can see that the spatial distribution of these different hazards is quite variable, and each is understandable based on both the meteorology and the topography. But then when you look at the intersection of these, is what, you know, which are the neighborhoods or communities that have a higher probability of having more than one day of such hazard. And it turns out that some communities are disproportionately at risk of having, say, high heat index days and days of high ozone or days of high precipitation. So on the right, you see sort of the intersection of those, and a couple, you know, communities in Western Massachusetts and across Connecticut really show up as being at relatively higher risk of experiencing more hazards in any typical summer. Next slide. So, of course, COVID has changed our context. We are all spending a lot more time at home and with ourselves. Social distancing is now the norm. We're making zero to very few trips to work. Many of us are battling or figuring out how to adjust to a new reality with less childcare available, with in-home schooling. There's a tremendous amount of unemployment and economic hardship, and these changes in the context have direct impacts on our vulnerability to heat, because we expect there'll be less access, people will have less access to air conditioning, either because they have less money to financial means to pay for the electricity that air conditioning uses, or because we're taking fewer trips to work. And for many people that work in commercial buildings where air conditioning is provided, that may no longer be an option, either because we're working from home or because more people are unemployed. All the changes in our context also are expected to have pronounced impacts on our physical health for sure, and mental health even more strongly. So we expect that individuals will be more exposed and more vulnerable. Next slide. So this poses several challenges. So the hazards we expect to remain the same, although, as Bradley pointed out, maybe even hotter this summer. But the exposures that people are experiencing are likely to be amplified, and individuals may be more vulnerable and less resilient than they have even as recently as last summer. In addition, the existing adaptive measures that are common as a public health response to this threat may carry new risks. So what's the approach to encouraging people to use cooling centers in a world where we have to maintain social distancing or physical distancing? So public health and emergency management agencies will need to implement new adaptive strategies and adjust the old ones for the new reality. At the same time, government agencies and healthcare system are already strained, so we'll need to focus on the most effective and efficient adaptive strategies. Next slide. So just as an example that from an analysis that we did a couple of years ago, showing that issuing a heat warning, an excessive heat warning on its own did not appear to reduce mortality from heat. And this has a lot of caveats with it, but it only had data through 2006. And so in that time period, in these 20 cities, we saw that a heat warning was not associated with a reduction in mortality, just emphasizing that we need to challenge ourselves to go beyond communicating the risk to cities and towns and individuals, and to adaptive solutions that are going to actually reduce the potential harms from excess heat. Next slide. So we really have the same goals from a research point of view. We really have the same goals that we did before, but it's now, of course, a new context, and for me, at least, a renewed urgency. We need to quantify the local health risk posed by extreme heat. We were doing that before, but we need to realize that now we're in a new context, and so we really need to see how those estimates have changed or will change this summer and beyond. We need to continue to identify those individuals and communities at greatest risk so that we can help them. And then we're going to have to develop or adapt the existing adaptive strategies to, such that they're appropriate in the local context and are as evidence-based as the science allows. And we'll have to then evaluate whether these strategies are being effective in reducing the public health burden of heat. And then, of course, we have to keep repeating this and doing it in an iterative way so that we keep up with the rapidly changing context. Next slide. Okay, I'll stop there. Thank you very much.
Okay, next up, Perry Sheffield.
Hi there, this is Perry. And I think, oh great, thanks Dan. Hi, and thanks to the organizers. It's great to participate and see some familiar faces on this webinar, and some new ones too. So we have probably all seen some of the staggering statistics of the disproportionate burden that COVID has taken on Black and Brown communities in particular in the United States. We see here in these graphics across multiple states, we're seeing these disparities between African American populations and white populations. Next slide. And that's true across the US, affecting not just Black communities, but other communities of color as well. And here from a county example in Washington State, we see that as well. And many people have expressed surprise, much to my surprise, that this is the reality we face. So I wanted to sort of think about that and unpack it, and also look at it through the lens of heat as well. Next slide. If you're familiar with the epi literature around heat impacts, or if you've read this book by Eric Kleinenberg called Heat Wave, A Social Autopsy of Disaster in Chicago, or seen the documentary that Judith Helfand made called Cooked, Survival by Zip Code, you can probably pretty easily begin to connect the dots between both of these, what they call slow motion disasters, in the case of what happened in the 1995 Chicago heat wave, and what happens every summer in the United States, and what we see, particularly when things get more extreme than usual. And so you can probably start to see the linkages that seem so apparent if you spend time thinking about these sort of disparities and what has emerged from COVID. And you understand that those who are expressing surprise are either lying or really woefully ignorant of the epidemiologic reality in our country. Next slide, please. So in that, actually in the documentary, Judith Helfand interviews the retired Chief Medical Officer, Dr. Linda Ray Murray from Cook County Department of Public Health. And she says, when she paraphrases James Baldwin, and she says, to be Black in America and to be relatively conscious is to be in a rage most of the time. Because of the reality. She was being interviewed and talking about the 1995 heat wave in Chicago. This could have applied to, I've heard many similar quotes relative to the epiphanies some people are having around COVID, but obviously this was said much earlier, decades ago, by James Baldwin. So next slide, please. So there are a number of working definitions of vulnerability, but they all dance around these concepts of exposure, your underlying sensitivity, and the impact, and by and large, probably what's most effective is the way we frame it and study it when it is focused on the modifiable social and environmental factors. Certainly genetics plays a part, but that's actually sort of debatable about whether or not how much we fold that into vulnerability and how practical it is. So we can think a little bit, looking at this graphic, about what makes someone vulnerable to heat. And we can think about the exposure, and we certainly think about outdoor workers, and we think about outdoor athletes, those who are exposed to the ambient temperatures. We think a lot about those in non-climate controlled or inadequately climate controlled situations, either without air conditioning, without money to pay for the air conditioning, or a misperception of risk. So if they have access to air conditioning, but then choose not to use it, and that might be based on their past life experiences, habits, their changed life stage, where they might not have needed it previously, but now do based on where they are. And perhaps now living in a different climate with different architecture and different sort of built environment protections. And then we also think about their underlying physiology, which is usually, in many cases, less about their underlying genetics and more about the life experiences that have contributed to change their biology by contributing to chronic conditions or just where they are life stage, very early or very late. But this is also related to their physiology, and their exposure is related to their built environment. I think we're going to hear a bit more about that in the next speaker. Maybe the greenness of the communities they live in, their perceived safety. Do you feel safe opening your windows? And also, do you have a social network checking on you? Many of the solutions that people are working on are tied to all of these factors as we start to unpack them more with the literature. Next slide, please. So here's another graphic about COVID disparities. Now this is looking at New York City. Doesn't actually say, yeah, it's not very clear from the slide, but this is New York City data. And it looks similar across cases with deaths. The rates of the Latinx community is actually higher than the Black and African American community. And I just want to make the point that is the more we understand the underlying causes of the individual level of vulnerabilities around heat, and I expect this will become the case around COVID, we understand that the bigger upstream contributors are structural, systemic, and often intentional efforts by people in power to protect their power status and their privilege status in society. And that goes way back. And so while I never considered myself a student of history, more and more as I do research, I realize how critical it is to understand how things like 40 acres and a mule, which was then offered and then retracted from Black communities in America, or slightly more recently, redlining, which affected home mortgage options, or current policing practices, or closer to my profession, healthcare disparities. For example, we know that Black individuals are undertreated relative to whites for pain, for example, in emergency room settings. So there's a lot of practices that we are indirectly, hopefully, and unwittingly potentially participating in and perpetuating these things. Next slide, please. So time will tell as we start to unpack COVID, for example, how the disparities we're seeing are related to these contributors that I have mentioned on, but some of the emerging stuff that's coming out speaks to these sort of structural and systemic things. So we know that essential workers are the ones that have been traveling more. And we know that actually a higher proportion of people of color in New York City are in those essential worker categories. We know that things like length of commute on public transport have disparities by race. The likelihood of protection, that you have a job where you were provided adequate personal protective equipment, the likelihood that your health complaints, your conditions will be equitably addressed by your supervisors, by your primary care physicians, or by the emergency room or hospital treating team when you arrive there. So historians and other social scientists have been making the case for a while that the root cause of vulnerability is something bigger than some of these individual factors that we often name and are important as a starting point to unpack, to get to that understanding of structural racism and structural factors. But the biomedical community is slowly catching up. And so this framing and this as a working hypothesis has implications about how we design and conduct our research and how we translate our research into action. So that's what I have to say today, and I'm going to pass the mic to Dr. Franco Montalto to talk about heat resilience next.
Thanks, Perry. You can hear me. Great. I am going to change the sort of focus a little bit into what do we do about this? You know, we're facing COVID, we're facing, as Radley said, a highly probable extreme heat season. So part of what I've been working on recently in Philadelphia is trying to think about cooling strategies that could be implemented, in particular in some of the neighborhoods with some of the characteristics that Perry just profiled. Communities that are facing a range of risk. And if you show the next slide, one of the inspirations for me in the approach that we're taking, I'm going to talk about the Sustainable Development Goals, but for a second, I want to just talk about Sandy. After Hurricane Sandy in our region, there was a very interesting discussion about what to do. How do you build back? What are the goals? Are we building back what we had before, or trying to build something different? And for me, an interesting framework for those discussions was to think about this sort of global framework that's right in front of us, the Sustainable Development Goals that have been approved by all of the United Nations countries that talk about these 17 sets of priorities that we have. So while COVID is raging, while the climate is changing, there are these goals out there that involve some, addressing some of the factors that have been touched on by previous speakers. For example, sustainable, looking at Dan's email, okay, sorry. Sustainable Development Goal 3 is focusing on health. Sustainable Development Goal 10 is focusing on inequality. Sustainable Development Goal 13 is focusing on climate action. So we do have this framework. If you could go to the next slide. In the IPCC special report issued in 2018 that focused on everything that we need to do to limit global warming to 1.5 degrees C, with high agreement and a degree of and a medium amount of evidence, one of the conclusions was that adaptation strategies, if we're not careful about them, can result in trade-offs with and among the SDGs. So it's possible that we try to do the best we possibly can to reduce climate risks, but we increase inequality, for example. Or, for example, if you go to the next slide, one of the examples given in there is exactly the issue that we are facing right now. Strategies that advance one SDG may create negative consequences for another. For instance, SDG 3, health, versus 7, energy consumption. And that's, of course, there's other examples here, but that's very much I think at question right now when we think about what do we do about this. If you go to the next slide, that is not to I'm waiting for the next slide. Then there you go. So New York City is out in front of this, trying to synchronize SDG 3 health with SDG 10 reducing inequality. Right, New York City is giving out 74,000 air conditioners to low-income residents. to, if you look at Director Bavici's statement right there, refusing to let low-income communities that have been hit by COVID-19 to also be hit with extreme heat. So there's a recognition of the need to do two things at the same time in that policy, but it is air conditioners, right? And if we go to the next slide, the question that I would pose to this group is how many more SDGs can we stack on top of one another as we grapple with all the things that we're trying to deal with, right? COVID-19, intense heat, and all of the development challenges that we know we've had all along. Go to the next slide. So I did a little bit of a literature review on this. This is not my area. I really work in the water and flood area, but I've been looking into urban cooling strategies, and there are a variety of techniques in addition to air conditioning that are being piloted or in many cases implemented around the world. You can kind of categorize those as evaporative techniques, cool materials, and greenery. So evaporative techniques are essentially trying to convert incoming radiation into evaporation and then convect heat away from the surface. And I'll give you a couple of examples of that. Cool materials warm up as much because they're reflective or are otherwise specially designed to be cooler than their conventional alternatives. And then, of course, there are all of these green approaches that do both of the above, right? So green approaches are connected to evaporation. They provide shade and therefore reflect or deflect some solar radiation. And then they're connected to this broader strategy of nature-based solutions, ways that we can make our urban ecosystems or urbanizing ecosystems more functional in a sort of diverse way of thinking about this. So if you go to the next slide, advance the slide, thanks. So I'm just going to show some pictures of, in this literature review, ideas that are sort of provocative things that could be implemented. So these are shade sails that you see all over the city of Cordoba, Spain. Of course, that's a different climate than we have here in the Northeast US. It's a Mediterranean climate, but there are these sort of simple shade sails that could be constructed to prevent the sun from, or just to create shade in what is otherwise a vegetation-less environment. Go to the next slide. In Spain, I was talking to a colleague who's active in these issues in Spain, who was showing a similar concept that seems to be all the rage in Mexico. These Maya Sombra shade cloths that are essentially strewn up even between buildings, on poles in lots of different places, again to provide shade. Go to the next slide, please. And can you advance, please? Okay. And then there's a whole series of spray cooling techniques. Misters, the slide on the right is in China. And you can see misters are very interesting. And I'm very interested from a public health perspective to hear. I know that misters, one of the advantages of misters is dust suppression. I feel like an interesting research question is what's the impact of that on for example, droplets that may be carrying the COVID-19 virus. But these are, of course, techniques that you see around the world, even in temperate environments, that reduce the impact of heat. Go to the next slide. I'm just going to go sort of quickly through a number of these photos. For some reason, there's a hitch. Yeah, there you go. An interesting technique that's been around since the 17th century in Japan, where it's known as uchimitsu, is evaporative cooling, sort of pavement irrigation processes. The thinking here is that if you wet the pavement, then the radiation, the solar radiation hitting the pavement will evaporate the water and not heat up the street or sidewalk surfaces. And in that way, at night, when the heat island effect is at its peak, you have less of a radiator sitting outside your window. And so these techniques are now being introduced in other cities. Next slide, please. This is from Darwin, Australia. This is an engineered shade structure made with vines. And we've got lots of examples of this. I'm just showing one picture. If you go to the next slide, I have a recent report produced by the Nature Conservancy that looked at 245 cities around the world and said that almost 70 million people are benefiting from between 0.5 and 2 degrees C reduction in maximum air temperatures due to tree planting. And the little graphic there on the left shows that they're fairly cost effective compared to other strategies that you might be thinking about. So these greenery approaches have some merit. Go ahead, next slide, that's fine. And then there's all kinds of other sort of interactive water plazas. The one on the left is right here in Philadelphia. The one on the right is Manchester, England. But there are, next slide, and then one more slide. There are fun ideas as well that people are thinking about. But I want to go to this framework. This is sort of how we are thinking about planning cooling strategies in Philadelphia right now. We're still very much, you know, the literature on the effectiveness of these different strategies is sparse, and in part it's because different strategies are implemented in different places. There's no real agreement on how to measure the effectiveness of these strategies. The very few of the studies actually have control plots, so it's very hard. There's a, you know, we're still trying to do the research that's required to measure the effectiveness of these strategies. But when you think about them in a city that has a range of needs, you know, harkening back to that SDG graphic, you certainly need to inventory a full range of community needs. And there's some kind of a community engagement process that you need to think about before you go into a community and propose or prescribe a specific approach. There are the heat vulnerability factors that we heard about from the previous presentations. We now are layering onto the social distance guidelines. And then as an engineer, I have to say that there's the typical urban design process, codes, ordinances, physical realities that need to be considered. And all of those things kind of come together into pilot projects. And I've been calling these multifunctional adaptive cooling projects that, yes, address the challenges that our communities will face in terms of extreme heat. Yes, respect social distance guidelines, but also enable communities to do a lot of the other things that they need to do. And we are in particular interested in the possibility of engaging the community in the actual implementation of the projects and their monitoring. So distributed or decentralized adaptation strategies can be an opportunity also for workforce development and for creating a very constructive set of discussions within communities about how to prepare them for this risk, but also other risks. And I'll just go to my final slide, which is just to say that risks are many. You know, just like after Sandy, the next challenge doesn't look like Sandy. The next challenge looks like what it will be. There's lots of risks. The development needs are many too, and we can't forget about those sustainability needs that we've had. And that means that these strategies, you know, here we're talking about heat strategies, but in general, infrastructure strategies need to be multifunctional. We need to have multifunctional infrastructure systems, multifunctional policies, multifunctional programming. And, you know, it can seem unbounded. What do you decide what functions get included? And I think that's the space where we need to really promote democratic, deliberative, and participatory decision-making processes. So we need to start the discussion with the community, meet them where they are, and develop strategies that address a range of factors that they articulate. Thank you.
Great, thanks, Franco. So we're going to sort of further shift out into the field in a moment, but I think what the presentations kind of well illustrated was this issue of this kind of the confluence of the question of extreme heat hazard and connecting to public policy that's been developed to address that. And now the COVID situation has sort of intersected with that question. And in some cases, the issues emerge, is this really the best policy? Of course, the example that we heard of the cooling centers, which are a very efficient way of providing, you know, a public policy response to extreme heat, obviously in the context of social distancing become an issue. Air conditioners, an immediate fix, but also kind of a cross connect to other public policy imperatives such as greenhouse gas reductions. So a rich sort of mix of things. And now we're going to look more out into the field, different perspectives, and then of course circling back to some of the questions. So we're really, to start this off, we're really benefited by having Oliver Sellers Garcia here. And so we'll turn it to you, Oliver, and then back out a little bit and then back out further to the audience.
Great, thank you. And Ellen, please wave if I start to break up. I've been having some bandwidth issues. I am Oliver Sellers Garcia. I'm the director of the Office of Sustainability and Environment in Somerville, Massachusetts. I am a last-minute replacement for a better speaker, Sam Lipson, from the Public Health Department in Cambridge, Mass. So you will forgive my one-slide presentation. If you are not familiar with Somerville, we are a city of 80,000 in the urban core of the Boston area. We're the densest city in New England, although I think one of the things that the pandemic has exposed is that, per capita density per square mile is different than density in housing. And our neighbor in Chelsea, a city that is technically not as dense, is really demonstrating the variability in that. I am the director of OSE, but now almost everyone in the city of Somerville has a additional or new assignment in an incident command structure. So it's interesting to see where climate is and long-range planning that we've been doing intersects directly with emergency service delivery that sometimes is or is not related to our full-time jobs. I have noticed, though, that in the region and across the country, folks like me who think about climate all day long in city governments have been among the first to start to think about heat and the pandemic response, because this is something that's on our radars from looking at the way climate is changing and impacting our cities. It is not necessarily the top priority, or hasn't been yet, in pandemic response at the city level or state level in our region, but I think that is rapidly changing. So if I could move on to the next slide. I'm gonna just talk about some nuts and bolts about how some of the ideas that you've heard of from the other speakers are playing out in actual programming, policy, and service delivery during the pandemic crisis. So to put a really simple characterization on it, what the pandemic is doing is that it is causing more potential heat risk because of more people indoors in unconditioned areas. And it's also changing the cooling responses that we traditionally have. Somerville completed a climate change vulnerability assessment in 2017, and we have understood to some degree the risks of heat, which were laid out very well by Greg in his presentation, and they are primarily, from our perspective, health and equity related. So we're worried both about acute heat stress, for example, someone waiting for the bus and making a different kind of transportation decision because of that, but then also folks with chronic conditions, our elderly citizens, children, and we're very aware of the racial disparities of how heat impacts our communities. So just because of location and condition of housing, correlations with underlying health conditions, and also historic barriers to access some of the mitigation that is available to heat, which was laid out so well by Perry. And what these are always concerns for us. We are also worried now that there is a increase in these stresses leading people to make unsafe choices that we now are adding to the things that we are looking to help our citizens with. So over on the right side, I've boiled down really what our urgent needs are and what we're taking action on in one municipality. So zero surprise here, there needs to be more air conditioning. We know from our tax assessors data that only 15% of residential properties in Somerville have central air. It's very hard to estimate how many have window units, and what, on top of that, what are the economic and social barriers to adding more cooling, especially in this context. So understanding the size of the air conditioning problem, just from a program setup standpoint, is very difficult. We are looking to see how, you know, there might be existing programs that can be used to you know, expand access to air conditioning. So for example, LIHEAP is a program across the country, low income heat energy assistance. And we're learning now that that's really a program that is geared toward the heating season, no surprise. And there'll be some difficulties in seeing if we can use that in the summer, but we're looking to see if there can be adjustments and you know, quick policy changes at the state program level to both fund air conditioning, acquisition of new air conditioners, as well as reducing the cost of running them. What I think is interesting to point out is that we're pretty sure that a lot of these costs would not be FEMA reimbursable, which is how a lot of cities and towns are making quick responses to the pandemic. The other thing is that our climate action plan, Somerville Climate Forward, that we released in 2018, really centered a lot of its heat responses around strategies like the ones that Franco mentioned that are more adaptive. So, you know, tree canopy for cooling, other sort of longer term strategies, and not focusing on an immediate priority, an immediate crisis. So then the second here is utility costs. So basically, again, we're not quite sure how big this problem is going to be in our city. But even if you have an air conditioner, can you afford to run it? Will you choose to run it if you're worried about costs? So the strategies there that we're looking to see is try to maximize enrollment in whatever programs there are for utility cost reductions, and then to explore if there's any opportunity to very rapidly maybe deploy either information or assistance in energy efficiency that can, you know, counterbalance increased electricity costs, and maybe has a side effect of increasing comfort as well. The other big bucket that we're working on is you know, policy and decision making around how outdoor space is used. So I mentioned our climate action plan that, you know, we have done a lot with a very little amount of open space in Somerville, and we are really sort of oriented as a community toward increasing vegetative cover, increasing tree canopy. You know, it's all about being cool and comfortable outside, and that changes substantially when people have to keep a physical distance from one another. So we are, you know, from a very practical level, we're trying to think about rules that are easy to understand for how to behave and use public space. And we have been working with neighboring cities to figure out how we can have effectively the exact same set of rules, because if you've been to our area, our cities are completely interconnected. Many people don't even know what municipality they're in at any given point. And we need to have a common set of guidance on how to use public space. And that might mean increasing the use of outdoor space into areas that are streets or other non-park spaces. And then we also have to think about, you know, areas that are now going to be used differently that could be sources of acute heat stress. So I always think about the long lines that are forming at supermarkets. Do we need to help businesses understand what are the parameters and needs for providing shading or virtual queuing, all sorts of different things. Because again, it's hard to judge how big the problem is going to be. We can tell how long a line is outside of the supermarket. What we can't tell is what seniors chose to put off buying food or going to the drugstore for a week, and that was dangerous because they saw how long the line was last time. And then the final area where we're taking immediate action is on communication. So understanding that a lot of people listen to the city, but we're not the only source of information. This has to be something that we are able to have consistency and find messaging surrogates to get this information out there. But there's a lot of things that have changed. So, you know, I thought the point about a heat advisory was interesting. For us, we always think about how, you know, if there's a heat advisory in Boston, that's what people know about. They don't pay attention if Somerville has a heat advisory because, you know, everyone looks at the Boston Globe, not the Somerville paper. So to really have some consistency there, repeat the messages that, you know, medical system is available. Oh, I'm sorry. Yeah, you can just stay on that second slide. I really don't have very much. How to use public space. And as I mentioned, there's new needs that are popping up. So for example, there's a lot of youth with free time now. So what are some messages that we can, you know, hit new populations that we normally don't do a lot of messaging to about how to stay safe in warm weather. So I have regional coordination and sort of a separate category because we've been doing a lot of that. So immediately with our neighbors in Cambridge and Boston, we've been working quite a bit together as part of a national network of the Urban Sustainability Directors Network, which is around 200 municipalities from across North America. There's a lot of us working on this as well. So that varies quite a bit. So for example, I was talking to a colleague in Philadelphia who's redistributing guidance on how to use a fan properly, because that doesn't always help with indoor heat. Or in Tempe, Arizona, really focusing on outdoor cooling centers. You'll notice that cooling centers is not on our list. We are a small city with very little space. Our cooling centers are barely ever used. Research from our neighbors in the city of Cambridge indicate that at least in our area, people will do pretty much whatever it takes to stay home before going to a cooling center. So we're trying to meet people where they are there. So in addition to coordinating with other cities, we're also working with our regional planning agency, the Metropolitan Area Planning Council. And then on top of all of this, I don't want to lose sight of a point that Franco mentioned, which is that some of these responses like go in the opposite direction of some of our other goals. So, you know, how many different things can you stack up before you start to see some contradictions? And so again, one of our longer term cooling strategies in our climate action plan was a rapid uptake in air source heat pumps that provides cooling, but also very efficient electric heating. So underlying all of what we're going to be working on in the next 4 months, we are trying to keep alive and not forget that we may very well be in another abnormal cooling season next year, and that if we drop the ball on some of our longer term goals that really do advance our greenhouse gas emissions priorities, we will actually be in a better situation for another difficult cooling season with physical distancing. So on the next slide is my contact information. That's all. Thank you for the opportunity to talk today. And if there's any questions about what cities are doing, I look forward to discussing those.
Great. Thank you so much, Oliver, and to the other panelists. I mean, Oliver, you really brought us down to the ground and sort of gave us some good details. I mean, the issue of queuing in lines, you know, sort of makes it very visceral, like the challenges that we're going to face in the context of trying to address some of the COVID constraints and cooling requirements. So we're going to sort of shift now some of the conversation a little bit out into the audience. So, just as a quick, and at some point, some of the other panelists could return onto the screen to respond to questions. But we also, as part of, I mentioned that this event is co-sponsored, at least through the CCRUN RISA program. We have a couple of other RISA colleagues on the line who could bring forward their perspectives from other parts of the country very briefly. I think we're able to sort of connect with the Pacific RISA. Maybe we'll turn to you in a moment if that connection is possible, and then also the Climas RISA based in the Southwest. Oliver, you just mentioned Phoenix, and obviously they've been doing a lot with respect to heat, and now they have to also rapidly sort of cross-connect to this issue of COVID-19. So I want to see if some of our Pacific RISA's folks are out there and able to say a couple of words. Is that correct?
Yes, aloha from Honolulu, Hawaii. This is Zena Grekny. Thank you very much, Bill, for the opportunity. I am the Sustained Climate Assessment Specialist with Pacific RISA, which, as Bill mentioned, is one of the NOAA RISA programs, and we serve Hawaii and the US affiliated Pacific Islands. So very interesting webinar. Really struck me that the interaction of extreme events like heat waves can really exacerbate underlying factors and exposures. And I think Perry was touching on this a lot in her talk. We're definitely seeing that out here in the Pacific Islands. Not so much yet with heat, but with storms. So one example I wanted to highlight is in the Commonwealth of the Northern Mariana Islands. These islands are in the same chain as Guam. They're in the Northwestern Pacific. And over the past 5 years, the Northern Mariana Islands has experienced 3 major hurricanes. They're called typhoons here, including 2 in 1 year between 2018 and 2019. Typhoon Yutu, you might have heard of in the media, was the worst storm to strike since 1935 on US soil. It was caused extensive damage across the Northern Mariana Islands and basically took out a lot of the tourism infrastructure, tourism being the main economic driver there other than US federal funding. So now, in the absence of visitors coming to the Northern Mariana Islands due to the pandemic, the government has really found itself without the means to pay teachers and public employees. And so this lack of income from the government through teacher salaries, through public employee salaries, which is a big part of their overall workforce, that lack of income is sort of cascading through society, and we've seen systemic risks like poverty, hunger, even domestic violence and suicide really elevated during this time. And so we're trying to figure out how best to support our partners there, the government officials that we work with, and sort of grappling with how do we lend support in such a sort of extreme cascading situation of rising risks for the Northern Mariana Islands. So, and we also see studies raising confidence right now in climate change and a warming world, increasing the intensity of hurricanes. So I wanted to turn it over to my colleague, Victoria Keener, if she's on, to sort of share her reflections as well.
Hi, can you hear me?
Yep, we're good.
Okay, great. Hi, this is Victoria Keener. I am the lead PI of the Pacific RISA out here in Honolulu. So I know that Zena talked more about the impacts and kind of the compounding hazards that we were seeing, but I wanted to put another spin on it in terms of the heat impact in Honolulu. So like Oliver mentioned in Somerville, in Honolulu, the Climate Change Resiliency and Sustainability Office has been put in charge as a lead agency for COVID response at the city level. And so it has really added that to their already very full plate. Last summer, the office also led island-wide heat mapping, which gelled with what previous speakers have said that many of the hottest areas that we identified were also the most socially and economically vulnerable. However, something that's different is that Hawaii doesn't have heat waves like the mainland or even the East Coast. For the most part, neither do the rest of the Pacific Islands that we work with. However, we are having record-breaking ocean heat waves that are causing hotter summers on land. In Hawaii, most houses and many schools don't have air conditioning and haven't needed them. There have been cases of heat stroke in schools over the last few years that are increasing, but we don't even know if that's going to be the biggest issue again if schools don't start up for a while. I know a lot of people here purchased window units for the first time last summer because it was so hot. But notwithstanding that, we also have an extremely aged energy system on the island that's never had to take on extended and widely distributed loads from air conditioning from single family homes if they're stuck working from home all summer. So I've been collecting initial data on energy use from the university and other large institutions that will share it with me, showing that in the last month or so, energy use has decreased from about 15 to 25% in places in which staff are largely working from home. A lot of those places with labs that are still working are some of the smaller decreases. A question, so is that going to be enough of a centralized decrease to make up for the increase from individual AC this summer and electricity use? And how will this impact our overall carbon footprint for the state? Honolulu also has a high percentage of households with solar panels who are usually at work during the day, not personally using that electricity. So how will it impact city energy redistribution when people start using their own solar in the middle of the day? So one of the things to think about that I've been thinking about is how to facilitate these strategic collaborations between energy companies and large organizations with large loads that really should start creating these dynamic systems to handle upcoming challenges more nimbly. And I think these are questions that are probably relevant on the East Coast as well, despite our differences in climate. Thanks.
Great. Thank you so much. Yeah, that gives us a little bit of a kind of a larger view context and sort of similarities. So we're going to turn it actually now to just in deference to time, we want to make sure that we get some of the questions rolling, and the panelists, if they could kind of come back onto the screen. We're going to have Dan Bader at CCRUN Central read out questions. Maybe Dan, read two at a time, and then we'll let panelists respond, and then we'll go from there.
Sure. So looks like the first question here is directly at Radley. And the question is, are there the increased heat extremes accounting for a certain number of stations? And I'll stop with that one because then the next couple questions are all kind of bundled together on the same topic, so for ease.
So the question is specific to Radley about the heating projections and so forth.
Yes, are the increased heat extremes accounting for the number of stations?
Okay.
Yeah, so increasing heat extremes do account for changes in the number of stations. There are a bunch of procedures that can be taken and are taken to deal with various shifts through time. For example, changes in the time of day when temperatures might have been recorded, movement of the stations. So yeah, the types of data that we showed here for the National Climate Assessment and such do include adjustments for sort of non-climate factors. And the bottom line takeaway is the trends are very similar, whether those adjustments are included or not.
Great. Okay. Another point. Another question or a bundle of questions.
Question I think is directed towards Franco regarding the different spray techniques. What is the source of water? Drought and water supply continue to be an issue for many communities.
Right, that's a good point. And I mean, I think it depends. Usually it's potable water, right? You wouldn't want to be spraying people with non-potable water and having them inhale non-potable water. So usually it's potable water. And so there is a potential trade-off in terms of sort of scarcity and heat. And that's sort of to my point earlier about the potential trade-offs between adaptation strategies and other goals that we might have in communities. Fortunately, in the Northeast, you know, we do have droughts, but but less frequently than in other parts of the country. So, you know, I think, and in fact, if you look at these spray techniques, the majority of them are implemented in temperate climates, and that may, you know, China being sort of leading the way with these spray techniques, and that may be because of exactly that this question, you know, that you need to have an ample supply of water in order to be able to do this.
Okay, thank you. Dan, another question.
Next question. Today we've discussed active energy-based strategies at the building scale, such as distributing air conditioners, and passive strategies at the urban scale, such as cool paving. What about passive strategies at the building scale, such as incentives for roof insulation or window shading?
I can sort of address that. I sent a written reply there. I think that the urban scale adaptation, or these what are being called sort of passive urban scale strategies, are also beneficial at the building scale. And in my sort of written response there, I was saying, for example, and I know in some Caribbean countries, these misters are used on roofs because by sprinkling water on the roof of the building, the water is evaporating and it's keeping the roof cooler. And of course, if you shade a window, you keep sun from getting in. So there's a whole sort of family of passive solar design principles that I think in part because of our reliance on air conditioning, we perhaps don't always consider. But, you know, given the challenges that we heard, you know, expressed by Oliver and others about, you know, even if you have an air conditioner, it doesn't mean that you will be able to use it or will want to use it. In some of the communities that we're working with in Philadelphia, you know, there could be other issues associated with keeping a building cool, such that a window scale unit, you know, just can't really keep the house cool. And so, you know, in these contexts, I think the discussion needs to be broadened beyond just air conditioning, and some of these passive strategies can help at the building scale as well.
Yeah. It's interesting, just as a quick addition, you know, a lot of the conversation seemed to indicate, and Franco, you gave the example of New York City providing AC, and AC seems to be, you know, an easy out, it's immediate, etc. We also heard from the panelists, I think Greg raised the issue that people are going to be spending a lot more time, you know, in their own AC, and the idea of one of the things that we haven't yet heard from you guys today, I'm not sure if you could speak to it, but it's sort of inferred the idea of you know, more localized running of air conditioners in older electrical network areas, Oliver, like Somerville, where maybe you've never experienced the amount of AC use you're going to get because people are home, you know, 24/7 cranking ACs. You know, it's a question that's sort of raised in my mind whether that will be subsequent brownouts or you know, peak load demand issues that will cause it. I mean, AC is a good, easy answer. Obviously, there's a lot of downstream questions, even in the immediate summer electricity demand. I don't know if anyone can speak to that, or I'll just sort of kind of throw it up as a balloon and, you know, a reflection. Maybe go to a next question and we can sort of respond as we can.
Bill, I can just say one that I learned sort of through our discussion about developing a heating center or a cooling center, not a heating center, a cooling center here at Drexel. I learned that some of the Drexel buildings, even though there's nobody in them, will be cooled anyway because of sort of the intricacies of how HVAC systems work. So if you think about the fact that now you've got people who would have been in those buildings cool, now cooling themselves perhaps with air conditioning, there is the potential, you mentioned brownouts, but there's the potential that electrical demand from air conditioning would be higher than it would ordinarily because you've got the original sort of the office complexes, the empty office complexes being cooled, and now people cooling spaces that they would ordinarily not be cooling during the day.
Yeah, interesting. I don't know if Oliver, if you're thinking about that, or if you're dealing with that in Somerville, or if you want to move on to the next question.
Yeah, I'll just say briefly. I think no surprise, the main theme is uncertainty. I was just on a call yesterday with our program manager of our demand response program, and basically they have no idea what the peak shapes are going to be this summer. And so I don't know whether it's going to substantially change the demand in a way that really stresses our grid. But what I do know is that many of the, programs from the individual building management system and programs for facilities that are lucky enough to have them to, into like an overall pattern across the ISO region is very uncertain. And so we don't have the knowledge of how to immediately respond to the way that the grid is going to be managed. So uncertainty.
Okay, striking. Okay, Dan, next question.
To take a question for Greg here. On the health impact side, have you or colleagues begun to think about how or whether it will be possible to understand temperature effects on death and mortality given substantial excess mortality from COVID?
Yeah, it's a great question. It's certainly some of the techniques we've traditionally used to model and estimate the excess deaths or excess morbidity will be challenged by the high burden of disease from COVID. So I think there's some additional thought will be required there. But many of the designs or many of the studies use a design where you're comparing within a narrow window of time, say within this 2 or 3 or 4 week period, let's compare the rate of emergency department visits on a very hot day versus a less hot day in the same city. So I think it is a challenge. I think it is something we need to be cognizant of, but I am confident that the statistical nuance is there in many of the existing methods to actually tease out the separate effects of short-term heat, short-term effects of very hot days versus not. I think that we can do very well. I think what's going to be more challenging is those longer term studies of what happens on hot summers versus less hot summers. So obviously if this summer ends up being a hot summer, it's how do you separate out the summer wide effects of a hot summer this summer in the context of COVID from those of previous summers. That's going to be very challenging, I think.
Okay, maybe one more question. We also have Julie Trajan at the end to sort of say a couple of wrap-up points. So maybe one or if need be 2 questions bundled together, and then go to Julie and go to final wrap-up. So back to you, Dan, though, with questions if you have any more to bring forward to the group.
I'm going to take a quick one here, but I have been saving all of the questions that have come in a list here. So if we didn't have a chance to answer your questions, I will try to distribute them to the panelists here and have a written response and see if we can get that compiled and posted and distributed to the group. I will try to accomplish that. The question here is the idea of Uchimizu has always been attractive. Would it make sense for cities to spray street pavement on hot days, at least in neighborhoods that have a little bit of shade as a cooling strategy? And would there be a way to estimate the possible effect on temperature?
Yeah, so that's an interesting question. And in fact, that's part of what we're trying to build into our pilot in Philadelphia to actually measure on an impact and control street that are close to one another and have similar solar exposure, the impact. And there's a paper that I'm assuming that the attendees can contact us individually. There's a paper that I found that documents what's known about pavement irrigation strategies around the world and the different estimates and measurements that have been made on their effectiveness. So there's some information there, but the conclusion for that paper is that we need sort of focused, well-structured studies in order to be able to answer a question like that. But it certainly seems like an interesting strategy to think about in cities. And for example, in Philadelphia, there's a Play Streets program where if residents want to close their street during the summer between 10 and 4, they can. And so a question that we had was, well, could we, if the street's closed, could we open up a hydrant, cool the street? You know, the street is now closed, so it's potentially available for socially distanced sort of sitting outside. but could you combine this with some other opportunities? And I think it's an interesting one to think about. I don't, like I said, the research is sort of variable in terms of effectiveness.
Could I do a quick follow-on question as sort of the moderator's prerogative? You raised the issue of streets and so forth. Many cities, Seattle, London, now also New York, have closed off streets, tens of miles of streets, as a way of creating more public spacing for folks to do social distancing. Any quick comments from the panelists on, is that an effective strategy? Is that, in terms of, extreme heat, are there kind of caveats to be concerned about? It seems like it's become this sort of a kind of an interesting item that cities are experimenting with. Any immediate thoughts, quick thoughts, I guess?
Yes, so Barcelona has obviously been in the news in the last several years for their super block model, where they've deliberately closed off streets and rerouted traffic along other streets, and sort of it's not just closing the streets, but then converting, bringing in planters or other greenery to those areas, and the use of those is just wonderful to see how that's affected people's utilization of the space. Mark Neuenhausen at the Barcelona Global Health Institute says, what if we built cities for people instead of for cars? And it's a wonderful motto. And this seems like an unfortunate but perhaps good opportunity to try some of those approaches in major cities around the world, but in the U.S. here in particular.
And I think arcing back to the beginning of our conversation, COVID is a challenge. COVID is devastating, but also we need to sort of think about it as a process of potentially integrating opportunity or defining opportunity and integrating it into our resiliency efforts, our public health efforts, and that's sort of been part of our approach and sort of our messaging here. With that, we're going to have Julie say a few words, and then maybe we'll give each of you a final opportunity to say a closing quick comment. I know we're pressing up against time, but again, I want to thank the audience. Dan Bader and I will help sort of organize the questions and try to make those live and available for our panelists and with written communication following. Also, we have some other materials and sort of resource documents, resource references, that'll be available on some of these questions, which we'll be distributing as part of a follow-up to this. But maybe Julie, will turn to you, and then we'll sort of try to circle back and to see how much we can get in terms of closing comments.
All right, so I take that as a cue to be brief, which I know. And actually, I just wanted to thank you all so much for an amazing panel, really very interesting, and I learned a lot. So my name's Julie Turton. I'm with the National Oceanic and Atmospheric Administration, and I coordinate the NOAA's activities with the health community. And in particular, in this context, I helped co-found and lead the National Integrated Heat Health Information System with CDC and other agencies you see on the phone here. And I think my job here isn't to talk about NIHIS, but to sort of give a pathway for engagement. And I would turn on my video, but I understand we were capped out at a webcam limit. So I think I must be just a little voice on the screen. But anyway, that's fine. So NIHIS was designed in very short order to pull together the pieces of managing heat, health risk from heat on multiple time scales. And we were not starting from scratch. So many of you have been working on this issue for quite some time, that I thought, and so did CDC and parts of the Weather Service, that it would be really useful for us to kind of have a way to have a cohesive discussion about what's currently happening on the heat season timescales, what's happening on the planning timescales, what's happening in terms of targeting and helping specific vulnerable populations. How do we put a federal front voice together? So we have a portal, and you'll see the website there. And simple things like you can actually find the heat forecast that Radley showed initially. We've got the heat across timescales. We've got some vulnerable populations. So just as a way of following on, if you're interested in partnering or being engaged with NIHIS, let us know. Go to the website, email me. My email will be at the end of the slide here. So that's one way if you're interested in partnering, learning from each other as a part of this national network. the RISA is here, and the folks that were also on the phone, we definitely build on the work that's gone before. So next slide, please. Some of you've actually been involved in some of the regional pilot work as well. So the thing I wanted to mention is that we are doing some urban heat island mapping this summer, and Victoria Keener from the Pacific Islands RISA mentioned that before. We've got 13 cities we're doing this year. And if you're interested, this is a way to help understand where your heat island risk is, and then each city has their data that they can put with understanding where their vulnerable populations are and helping to use in managing their decisions and planning. So if you're interested in being involved in that, either participating somehow in this year or planning for next year, also let us know. Same site, same email. Next slide, please. And actually, we're so excited about that. It's very fun. It's very locally. On a global scale, we partner very much with other countries. So this whole learning locally, working globally, very much the case. Global Heat Health Information Network has a series of things designed specifically to get at this interface we're talking about here, is how do you manage heat in multiple contexts, but they're not all targeted for COVID, but they are targeted about heat and health and joint learning. And so you'll see here a series of master classes coming up really soon, a series of dialogues about heat in the city and heat in the workplace, and a checklist for COVID and heat. So check out the GEN site if you're interested. There's also a GEN Digest you can subscribe to. So ways to get engaged, ways to follow on after this amazing conversation. So if you're looking for ways, that's one. And then last slide. The group on Earth Obs has a community of practice that is specifically talking about Earth observations, environmental information, COVID. If you're interested in participating, please check that out. Last slide. And then skip over that. I put, just for your information, CDC had to come up with specific guidance for heat and COVID, and they're one of our core partners. So this is the guidance that specifically came out this year. I'm sure you all have it, especially if you're in health departments, but if you don't, it'll be available to you after this. And then the last slide just has my contact on it. So I just wanted to say that it was amazing to listen to everybody talking about the different options. I loved the link to Sustainable Development Goals and all the local experience about cooling and air conditioning and how to manage energy load. So thank you very much. And click one more forward, please, on the slides. So this is my inspiration. I love Einstein. Anybody who knows me knows that. So I just challenge us all to think, as you all have done throughout this talk, creatively. How do we move forward and act differently? So thank you for the opportunity. And please, please, let's find a way to continue collaborating and continuing to work together after this.
Great.
Thanks
so much. Thanks so much, Julie. That was really a great summary of some of the points that we've been trying to discuss here. What I want to do is just give the panelists, if anybody has a quick comment that they felt like they wanted to get out into the mix. Just as a reminder, we will try to get some written responses, the PowerPoints and other things that we've been discussing, and some of the other materials will be available on the CCRUN website. So it's ccrun.org. It's not immediately present, but hopefully we'll be there soon, and we'll do some follow-up with this. But as Julie said, it's a great community of folks who are kind of engaged with this question, and it's a highly dynamic context. Julie, did you have a point that you wanted to raise? I saw a hand up for a second, but maybe not. Okay.
So just adjusting my screen. Sorry.
Okay. Excellent. So to the panelists, the others, Perry, Radley, Greg, Perry, Oliver, Franco, any quick closing thoughts, that you'd like to sort of bring forward? I mean, not that you need to, it's okay.
I guess I'd say, Bill, to echo your point, this is there's an opportunity here to change our thinking about how we design our cities and our lives, and the fact that many of us will be commuting much less to an office is, imposes some challenges, but also imposes some opportunities there. And the fact that cities have to rethink many of the systems and the way services are delivered, I think presents an opportunity to think about not just how to hobble along and do what we used to do under new constraints, but how to do what we used to do better and how to do new things that before weren't possible. And I see this sort of thinking needs to pervade sort of our educational institutions, our research organizations, our government organizations, and our community organizations. It's not just about trying to do the same things we were doing with handcuffs on, but to do new things so we can create a better world.
Excellent.
And I'll just add on to that. I think it's also for the practitioners in the room, this is also an opportunity to gather really important data about the effectiveness of different strategies. So if you represent a city or a community group and you are testing out various strategies, be they physical strategies for cool or even sort of policies, I think there's an opportunity for us to get together and develop sort of common tricks for evaluation, sort of experimental design issues that will help us learn from this summer, because these issues, although COVID may go away, extreme heat is here for a bit. So, I think it's an opportunity for researchers to work with cities and others who are doing pilot projects so that we can all adaptively use this crisis to go forward.
Yeah. Well put. Yeah, Julie, maybe you have the last voice. Yeah.
Well, oh gosh, I don't want the last word, but I do want to pick up on that point because I really do think there was so much information, rich information shared here among the panelists that I'm not just trying to plug NIHIS, I'm actually really want this opportunity to learn from each other as we move forward. So let's please try to do that. And it's sort of a second ask for everybody to really find the way to let us know, to learn from each other. We've got these, global forums, we've got NIHIS forum, we've got other forums, but this question you're raising about what are the most appropriate interventions, what are the creative solutions that we haven't even tried yet, and how do we create this better world? Those conversations are really critical. And so I'm just trying to give a pathway for them. And I think we have lots of opportunities to really, really make a difference now. So I just encourage you to not walk away from the webinar and say that was great, but to actually do something to get yourself engaged if you're not already. And now I'm done. Thank you, Bill.
Yeah, each of your comments are like this celebratory endpoint, and I'm thinking, well, that's a great capper, but then you each top each other. So anybody else to sort of say a final thing? Otherwise, we'll let you guys go and continue the good work. And thanks again to the audience for being engaged, asking questions. We've cataloged them, and we'll try to follow up. But I think Julie and others have said this is a community of folks who are trying to address a question that we almost see coming at us. These days have been cool over the last few, except for that hot weather of about a week ago. But we know summer is coming, and the implications that has, while it's enjoyable, it also means challenges for many. So with that, we'll continue the work. Thanks all.